instruments that we use most frequently throughout the case. Then I want to put those items that I need to attach to the patient after we get the drapes on. Okay, so those things are going to be my cautery, my suction, my light handles, and 2 dry laps. So I want to put my light handles up here, 2 dry laps to put on either side of the incision. And then I want to get my cautery and suction ready by determining the length I want to keep on the field and the length that I'm going to toss off. So you just take one end of your suction tubing. It's approximately an arm's length from the center of your body. You're going to put the pool tip on because we're doing an abdominal surgery. The tip without the sheath. We use the tip throughout the case, the sheath only at the end when we irrigate. Okay. So you're going to take a non-perforating towel clip. Just place it onto your suction tubing at that level. It's going to move. It's just an approximate. Okay, so don't worry about the fact that it's going to move. Don't clip it onto the tubing where it's going to put a hole in the tubing or anything like that. Just kind of place it on there, and then we'll attach it to the drapes once we get done. Make sure it's not a big knotty mess. I don't care where you put this up here. Just don't put it on your sharps. That way when you pick it up, you're not taking your sharps with it. Then you get your cautery ready by determining the length, again, that you want to keep. It's about an arm's length. Okay. Then you're going to take your cord, pass it through the back of the holster, around the bottom, and pull it up tight. Take your scratch pad, put it on the front of the holster. Save this piece of paper so we can reuse them. Okay, normally you would throw it away. Take the pencil and the cord that's going to stay on the field, put it back in the holster. Grab a non-perforating towel clip, put it on the holster. Don't clamp the cord because remember, if you break down this cord, somebody can get shocked and you can start a fire too because that's the insulation on that electric current. Leave this portion out. We're going to toss it off when we go up to the drapes. The cautery should be on the top because remember, cautery is the first thing we hook up because it's the first thing the surgeon needs. Okay, so it shouldn't be buried underneath there. So if your surgeon is raring to go, he can start while you're still hooking everything else up. Okay, after this is finished, then the order of the rest of this doesn't really make any difference, but you have to finish the Mayo stand before you move on to anything else, because these are the things I need to start the case. All right, so after that, then we're going to do, everything else is called our accessory or ancillary duties. These are things that I don't necessarily need to start the case. If I have time to get them done, that's great, but I can start a case without doing these things. Okay, so we're going to load a peanut on a long Mayo and just place it on the roll towel. You're going to load a sponge stick by folding a Raytech in thirds and just place that on the roll towel also. You want them on the edge that's closer to you. That way you can just turn around and reach them off your back table. So on this edge closest to your mosquitoes on the roll towel. You're going to load your Balfour with the blades that you want determined by the size of your patient. So we'll say this patient is a small patient. These load on here so that this little peg fits into this hole here and blocks on. So remember, you want the wing nut up, the blades down, and the blades need to face in opposite directions from each other. And this Balfour needs to be closed on your back table so that it's ready for you to hand up to the incision. Because obviously you're putting it into a straight incision and then opening it up. Addison forceps will go over on the suture towel by your suture. That way when you are ready to bring your suture up to the field, it's right here. You can just grab those 2 items at the same time. Then you're going to get your fluids on, which will be water, saline, and a medication. So if you guys can help me, I need water, saline, and a med. 3 different people. Okay, what do you have for me?
Water. Or, no, saline.
Okay, can I touch it?
No.
Okay, how are you going to give it to me? Okay, so tell me what it is first, right?
Sodium chloride, 0.9%, November 1st, 2014.
Okay. And you can fill your asepto while you're receiving this fluid, so double fill your asepto. Okay. And then you need to label it immediately before you move on to anything else. Now, remember we talked about a lot of facilities have these pre-printed labels. I'm going to tell you for your competency assessment, you may or may not have these. So make sure that you know how to write the label. So saline is either saline, sodium chloride, or NaCl. You need to label the pitcher and also the asepto. And make sure that you label the side of the asepto, not the top. And you don't have to put the 0.9%, it's all the same. Water's going to go in the basin.
It's sterile water, expiration date October of 2014.
And you have to, okay, no, we can't use it, right? So you have to
Yes.
say, we got a new one,
Yes.
okay, we have a new one. No, that's okay, go ahead. Just make sure that you label before you do anything else. That's good. So as soon as you get a fluid on, you need to label ASAP. So water is H2O or water, either one. If you have a pre-printed label, you can use it, but remember, you need to know how to make the label, because you may have blank labels for your competency assessment and in your facility as well. Okay, for your medication, we assume the circulating nurse has drawn it up into a syringe, because remember, this is one of the acceptable ways to get it onto the field. But she still needs to show me the vial. Okay, so we have what?
0.25% by bupivacaine.
So either 1/4% or 0.25% bupivacaine with
Expiration.
epinephrine, right?
Yep,
And what's the concentration of epinephrine?
1 to 200,000
Okay, and the expiration date?
is the 1st of March 2010.
We'll say 14, right? Okay. All right, so you can set that down now, because you're probably going to need 2 hands. Now, you can either take the cap off and give it to me with the needle on, or you can take the whole needle off. Just make sure you don't touch the tip of the syringe, right? Okay. Either one is acceptable. Okay, and then shoot it into my cup, but don't reach over because the syringe is not sterile. Okay, push hard, and you might need to use 2 hands. I know I keep moving away from you, but I don't want you to be reaching over the field. Okay, label immediately, create 2 labels. Remember that with a percentage, you need to have a 0 before the decimal point, but if I had 1%, you don't put a 1 and then 0.0, because it could look like it's 10%, okay? So always a 0 before the decimal, but never after. Okay, bupivacaine, written all the way out. With is C with a line over it. Epi is EPI, and then the concentration of 1 colon, and then 200,000. Okay, if you had a pre-printed label, you could use it. This one doesn't have that yet, up here. Okay, so right here we have bupivacaine with epinephrine. So you would just fill in the percentage of 0.25% and then also the concentration of 1 to 200,000. So you're gonna label your med cup, label your syringe, fill your syringe to 10 cc's. So remember that we read the syringe from the side of the plunger, not the center where it gets to a tip. Not where it comes to a point in the center. Get out your air bubbles, so tap it, make sure the air gets to the top, and make sure it's exactly at 10 cc's. And then put on your hypo needle, and just kind of set it over here by your suture towel. And then move your med back so it's out of the way and doesn't get spilled. Okay, you're gonna make 1 wet lap. So dip it in your water, wring it out as much as you possibly can. Remember that normally on a case you would make, 4 or 5 of these, but we're just gonna have you make 1. Okay, and then just roll it so that the radiopaque strip is exposed. Place it in your emesis basin. Then you're gonna gown and glove your surgeon.